a lower quadrant regional biomechanical examination. Let's have you stand up, patient. All right, let me have you face that way and back up towards me a little bit. There we go. So we're gonna go through, again, range of motion, but this time we're gonna do things a little different. So I'm gonna have you bend forward towards your toes. Good, and back up. And lean, and then lean back towards me. Good. Any change in symptoms with that?
No.
Come back up. Good. I'm gonna have you bend forward 5 times, okay? So reach down towards your toes and come up. Good. One more. Good. Any change in symptoms on that? No. So I would expect maybe the symptoms of the patient to get a little bit worse for our 35-year-old male with low back pain and radicular pain. Right now I'm gonna have you lean back towards me 5 times. Good. Any change? Doing okay with that?
Yep.
All right. For the 35-year-old male case, I would suspect that that might be a little painful at first, but as we continue doing it, he would feel some improvement. All right, now let's go left side bending. Good, and then to the right. Good, now because his pain is so provocative for the case patient, I don't know if I'd go right into side glides day 1 because he seems very much in pain, and that might just provoke things a little bit too much on day 1. So we're gonna go with the repeated extensions probably. Next, let's have you lay down on your back. I wanna just examine the hip just to make sure there's no maybe pathologies there, or if it does affect his back pain. How's that on your symptoms, okay?
Yeah.
Okay. And a little tight into flexion. Good. All right, doing okay?
Yeah.
All right, if the patient were to tolerate all of this, I would then try to rule out hip pathology. I suspect though he would not tolerate this too well, even though I'd like to look at this day 1. All right, and then I would also like to look at hip extension, although again, I feel like the patient in this case, this 35-year-old male, would not be able to tolerate that very well at first. So we're gonna have to try to do some pain modulation. But regional exam continued with the PIVMs. I'm gonna have you lay on your side facing me to start. Good. And you come over. All right, so I have my fingers between his spinous processes over here. We're gonna start, there's his PSIS. I'm gonna start at S1 and L5 here with my index and my middle finger. I'm gonna move the legs to assess flexion. Doing okay?
Yep.
Okay. I'm gonna move up a segment. And up. Okay. And then extension. And I would also do the other side as well. Now, because it's his left side, I would like to then get him onto his left side as well, but I'm just gonna assess a little bit of side bending through the pelvis here. And then rotation top down, I'm getting my left hand on here. And this is an extension, so this is more of a down glide, I feel like, assessment for him, or Pivums. And then in flexion, we can also do more up glide by getting him into flexion for some levels and assessing that. Good. All right, let's turn over. So now for the left side, this is his treatment side. I expect to find some hypomobility here. Let's assess the Pivums first. So again, my index finger is starting at S1, L5, 4, L3, L2. And I'm actually going to assess this side a little bit different in terms of side bending. Good. And then I'll bring them into extension Pivums. Pivums. I'm going to continue to assess on this left side here. Let me have you come a little bit closer to me. Good. All right. So first, I'm going neutral, and I'm going to assess rotation by stabilizing L5 spinous transverse process to then rotate him to see L4 on 5, and then go to L4, assess L3 on L4, and work my way up the spine there. And then I'm also going to do that in extension, assessing a little bit more down glide, so combo of extension, rotation, L4, 3, 2. So what I'm essentially doing here, I'm gonna grab the spine, is I am taking my thumb onto the transverse process here and then rotating from top down to assess the rotation of the one above. And I go to 4, and then 3, and then 2. And that I did a neutral, and then I just did an extension to gain more of like a down glide assessment there. Now I'm going to do it in flexion to assess more of like a gapping kind of up glide assessment. Oh, I don't know if you can see, but my thumb, I'm going to find the spinous process and come onto this side, onto the transverse, and rotate him back. L4, 3, and so on. All right. Then I could assess Pavums by having him on his stomach would be probably the easiest. So I'm going to turn on to your stomach there. Would you like to go? No? Okay. So in this case here with the spine, I'm going to assess a PA, general PA at the central PA. Then I'm going to do unilateral on either side. And the way I'm going to use it is my PZ form. I'm going to go onto one side as well as the other and assess that way. On the same segment, and then I'm also going to be one below with my other one up above to assess more of that unilateral rotation of the one above. All right, so let's move this down. Okay, so if I find PSIS, we got S1, L5. So I'm just going to do a general central PA on each of these, see how it feels on his symptoms, and see if there's any stiffness or hypermobility. Then, using a similar technique, but I'm going to go to the transverse processes. Now, L4, 5 are difficult to get to, so I'm going to try my best to do 5, 4, 3, 2. And then I could also utilize that one below, one above. So I'm going to go on the one side, and then I'm going to go above to the other transverse process. And my lower hand is stabilizing, only my upper hand is providing that PA. That was 4 and 5, then we have 4 and 3, and 3, and 2. And then I could go 2, 1 as well. And then I could do all on the other side as well.